All right, everyone. Thank you so much for joining us today for Medicare 101. Today, we are joined by Peggy. She is a licensed career agent with Integrity Health Advisors, and they specialize in Medicare solutions. So Peggy's goal is to assist Medicare enrollees, such as ours, to find the best plan for their own specific needs. And throughout her 30 plus year career, Peggy has worked for insurers, United Healthcare, Great West Healthcare, and Cigna. Peggy also worked in the provider arena as the director of contracting and managed care for the Children's Hospital of Denver. She came back to UHC Optimum in the administration and moving over to work direct one-on-one with individuals with a natural transition, and brings Peggy great joy to be of direct service to others. So Peggy does have a bachelor's degree in economics from Illinois State University and MBA coursework from the University of Phoenix. And with her time off, she enjoys traveling and any time that she can spend with her 4 children and her 2 grandchildren. So Peggy, with that, if you want to take it away, we're all ears.
Awesome. Thanks so much, Christy. I appreciate it. And thank you for letting me join you all today for this Medicare education session. I appreciate you taking time out of your day to learn about this. Hopefully I can give you some really great information. Like Christy said, I've been at this, and every time I say it out loud, I can't believe it. I've been at it since 1988. And I don't know where the years have gone, but here we are. I've seen a lot, many changes over the years and the way that Medicare is done and processed. I don't see it going anywhere soon. The Medicare system is not perfect. However, we've had this in place since 1965, and I don't think it's going anywhere quickly. So we'll go over this education, and I'll go through all of this and then put any questions in the chat. And Christy, if you'd help me with that. At the end, we'll go through any questions that you may have, okay? Peggy Michel, here's my info. If you want to take a screenshot of that, please do. You'll know where to find me. Christy also has my contact info if you need anything at all, any follow-up. I am an independent advisor. I am a broker, so I am licensed in 27 different states. I do this across the nation. I do presentations to employer groups. I do it specifically for carriers. I do it independent of. I do it for financial planners. I do it for any groups like oh gosh, like societies and things like that. I'll go in and do just to give you an education. We will not talk about anything plan specific today related to any carriers. We specialize in Medicare and Medicare only. We work for you. At the end of the day, my objective is always to make sure you're getting the right plan for you. And sometimes, like, I'll often have spouses that go completely different directions, but that's what's appropriate for their individual needs. So that's what we really try to focus on with this. We're going to go over today, what is Medicare? Who is eligible? When are you eligible? What are your options with Medicare? How does that work? How do you enroll in Medicare and choose the correct options? And what resources are available to you to help you make those choices? Who is eligible for Medicare? Or let me start, actually, what is Medicare? Medicare is our federally funded health plan. Typically, when we turn age 65 or under the age of 65 due to a disability. That disability means you've been notified Social Security, you've been on SSDI for a period of 24 months before you're eligible. Of course, you also have to have paid into the system. You know, we always say, who's that Mr. FICA? Well, here we are. And you must have paid into the system for 40 quarters, so at least 10 years. And you must be a US resident for at least 5 years. enrolling in Medicare B, C, or D for the first time? How and when do you enroll? When can I enroll? You enroll in Medicare at the age of 65, the birth month of your 65th birthday. You notify Medicare 3 months prior to your month of birth that you'll be enrolling in Medicare, or you also have the 3 months after. You also can enroll in Medicare when you retire, or you just lose your employer-sponsored health plan. A lot of people are reviewing that right now, and you do have the option to opt out of your employer plan and go ahead and enroll in Medicare. That at that time, it's considered a special enrollment period rather than an initial enrollment period when you turn 65. Well, what if you're late and you didn't enroll in Medicare and you didn't have credible coverage at any time? There is a general election period when you can enroll in Medicare, and you can do that January, February, March of each year for that general election period. If you missed it and did not have a Part B or a Part D, you had no coverage whatsoever, you may have a penalty assessed for those. That's what I want to help you avoid. Please ask questions when those situations come to you, okay? Again, it's our federally funded health plan. It's government programs. I call it, it's a whole alphabet soup of plans. So I'm sure every time you turn on the television, you're hearing about parts A, B, C, D. Do I need this? Do I need that? When do I get this? How do I get that? These are government programs. A is your hospitalization. B is basically your doctors or any outpatient service or equipment like durable medical equipment. And D is your drug plan. Part C of Medicare, excuse me. Part C of Medicare is managed by private insurance, and that's a Medicare Advantage plan. And then a supplement is supplemental coverage secondary to your A and your B. When it comes to Medicare, please notice right here, this is what your red, white, and blue card looks like. When you go through and make your enrollment, you'll have 2 options from here. The option for a supplement and a drug plan, or the option for an advantage plan, an all-in-one. When can you enroll in Medicare A? Again, you do your enrollment after your 64 years and 9 months. Enrollment is automatic if you're already receiving your Social Security benefits. No penalties if you are late. You will not be late. No penalties from that. And you enroll at ssa.gov or over the phone or in a Social Security office. I'm going to take a quick second here to advise you. I'm going to be super, super, super clear. Be sure you're getting your enrollment only through Medicare.gov. Medicare.com, eHealth, GoHealth, all of those are sales and solicitation sites. Please, please, please be sure that your extension is always a .gov. Once you click on one of those other sites and you put your info in, you have just given them the okay to follow up with you. And I don't want any of you guys to be receiving 100 phone calls a day soliciting you for this and that and giving you incorrect information. So really keep yourself and your information safe. What does your Medicare provide? Again, Part A of Medicare is hospitalization. So inpatient hospital care, inpatient mental health care, skilled nursing services when you go to a skill or a rehab center, hospice care, and then blood transfusions. What is the cost for your Medicare Part A? Most people do not have a premium for Part A. It is fully funded that through our lifetime of work. If you did not have all of those 40 quarters, so if you did not work in the system for 10 years, you may have to contribute to that Part A. But most of us, most of us have been working since we're 13. So most of us have that Part A covered. And you will, when it comes to Medicare only, Medicare primary, there is a deductible. And these numbers are hot off the press. The numbers in this presentation are 2024 numbers. Right hot off the presses is the 2025 numbers. If anyone would like that link to look at that fee schedule, again, just give me a shout. I'm happy to share that. But in 2024, the deductible for hospitalization through Medicare Part A was $1,632. Next year, it's $1,676. Multiple hospital stays means multiple deductibles. If you're in and out of the hospital several times throughout the year, you do have to pay that deductible each time. And again, Medicare is our federally funded health plan. It came out in 1965, and it was never intended to cover us. First of all, it was never intended to be free, and it was never intended to cover us across the ocean. So it's our homeland coverage. So that's a great question to ask when you're looking at plans, if you do a lot of traveling, to make sure that we get you that you have international coverage and you understand what that means. And if you need to supplement that above and beyond.
Hey, Peggy.
Yeah.
We did have a question about, does Part A cover in-home care from a caregiver perspective versus a nurse?
Did you get 8? Oh, let's go to.
I missed that follow-up, but so for in-home care, a couple of things related to that. That is a covered benefit. It's typically covered under Part B. It can be covered under A. It must be medically necessary. It must be ordered by your physician. It's never custodial care. They don't come in and cook and clean or help you with your bathing or any of that. It must be medically necessary. My favorite example is someone who maybe was inpatient and they went home with a port. And they need specific clinical care to come in and clean the port and to administer medications and to do that. They're not really sick enough to continue to be in the hospital, but they're well enough at home and that can continue at home. That's really how that works. So it is not custodial care.
Okay, thank you.
Sure, I hope that answered. What is Part B? Part B, again, is basically anything not inpatient hospitalization. So our physician services, be it your primary or your specialist, any outpatient services. So say you're just getting a knee scope and you have a day surgery and you do that at an ambulatory surgical center and they just send you home. Ambulance, outpatient mental health and therapy is covered under your B. Your lab services and anything like an EKG or an MRI or things like that are going to be covered under your B. Durable medical equipment, so wheelchairs, oxygens, crutches, the boot if you did something orthopedic, and then preventative care. So all of our wellness exams are covered under B. We do contribute to Part B financially. Okay, we Medicare actuaries, and it goes on there, determine what the average cost of Part B will be. They cover 3/4 of it. We cover 1/4 of it. So this year, it was $170. $470 was the standard rate for your Part B. Next year, it was just announced it will be $185 for the standard rate. If you are a high income earner meaning if your individual income, your modified adjusted gross was greater than $106,000, you will pay maybe more than your neighbor. And there's a whole fee schedule on that, and I'm happy to share that fee schedule with you as well. So if you fall into a high earner income bracket, then we'll look for that. Things you should know about Part B. I kind of jumped ahead. There is no, this is only the red, white, and blue card, remember. This is before you've added any advantage plan or supplements. So this is the base and the reason why you look at supplements and advantage plans, because there is no maximum out of pocket. When Medicare came out in 1965, it was developed as an 80-20 plan. Well, that made a lot of sense then. In today's world, with our costs, it really could be, gosh, it could bankrupt you if you had to pay your deductible and 20% of a major event, which is why we go with supplements and advantage plans to protect yourself, because original Medicare had no maximum out of pocket. You do, again, have that Part B. If you only had Medicare, you would have that Part B premium, which last year it was $174.70. Next year is $185. And then you have a deductible. This year it was $240. Next year it's $257. If you do not enroll in Medicare when you turn 65, and if you did not have credible coverage, then you would have a penalty assessed. So I'm here to help you make sure that there are no penalties assessed, and we're doing everything in that right timeline. If you are working and you are making use of your employer-sponsored health plan, you will not see a penalty. Okay, so you guys are all doing it right. Medicare Part D. Medicare dictates that we must all have a prescription drug program. Medicare develops the prescription drug plan. However, they don't administer it. Private health insurance companies, United, Humana, Anthem, Aetna, Blue Cross Blue Shield, who am I forgetting? Kaiser, Devoted, I could go on and on and on. They offer the insurance, and they must follow Medicare's rules. You must always continue to pay your Part B premium. The formularies of what each carrier has can vary from company to company. Benefits and costs can also vary from company to company. And you may be penalized if you do not get it. I hear it all the time. Peggy, I'm not sick. I don't take anything. Why do I need a drug plan? Medicare requires that everyone have a drug plan when they go on to Medicare. My kind of response is, well, I don't get in auto accidents. Why do I need auto insurance? Well, we all need it when something happens. So the good news is drug plans, we can find some super inexpensive standalone drug plans, and they're often included in the all-in-one Part C Advantage plans. So that's really good. It's easy to be compliant there. Part D. I don't know if any of you have heard the term the donut hole. And I didn't ask, would you raise your hand in the chat box if you are already on Medicare? I don't know how many of us that we have on Medicare already. William, are you saying you are on Medicare? Do you have it? Christy, do you have anyone saying they're already on it?
I do not yet.
Okay. Okay, good. Well, let's talk about it. You
Sure.
might have friends or neighbors or people who've said, oh, the donut hole, I'm in the donut hole, I'm paying so much for my drugs. Well, good news. If no one is on Medicare right now, you will have never experienced the donut hole, and we're all going to rejoice because that is going away. Starting in 2025, the cost of prescription drugs, it's going to be such a beautiful cost savings for so many people starting in 2025. So I love sharing this part of the presentation. Related to Part D, there are now only 3 drug stages. First of all is the annual deductible with Part D. You must satisfy or pay 100% of your prescription costs until you reach the deductible amount. The standard amount for your Part D deductible in 2025 is $590. Most plans and carriers only charge that on the high end tiered drugs, so a tier 3, 4, or 5. So that would be brand names, and higher end prescriptions are only subject to the deductible typically. After you've met that deductible, you'll pay 25% of your prescription cost. This phase lasts until your total out of pocket reaches $2,000. Sounds like a lot, doesn't feel good when it's $2,000, but I want to tell you in 2024, that number was $8,000. So it's $6,000 less per person in 2025. So that's fantastic. When you reach that $2,000 mark, you won't have to pay anything else for your prescriptions. It will literally be $0. So if you're one of those people that is on maybe a high-end heart drug or a high-end inhaler, or even, I mean, think about that person who's on oral chemotherapy. Wow. Next year will be $2,000, and the rest of the year they're done. It's covered at 100%. So this is a beautiful message that we're sharing this year.
Peggy, we did have someone jump on to say they are on Part A only, and they're currently
Great.
in the process of signing up for Part B.
Yes, yes. Well, give me a shout. I'll make sure you have, when you do that Part B enrollment later, there are 2 forms that we need to send in to Medicare to get that started and to certify that you have had creditable coverage up until this time, so no penalties will be assessed. So give me a shout. My information is kind of all over this, and I can forward you those forms, and we could get that into Social Security to make sure you don't have that. Thanks for speaking up. So Medicare Part C. Medicare Part C is a Medicare Advantage plan. I always call Medicare Part C the cup of Medicare. What it does is it puts everything into one place for you. Part C Advantage plans, they combine your A, your B, they usually include your Part D, and then they'll put in extra benefits like dental, vision, hearing, and other things that go above and beyond original Medicare. Again, these are offered only by private insurance. The private insurance companies are delegated by Medicare to adjudicate all claims on behalf of Medicare. Some of the most popular Medicare Advantage plans, some of the most popular Cs are $0. Some do, however, have premiums, and the benefits change from year to year. Eligibility for a Medicare Advantage plan. You must have A and B. You must live in that service area where they're offered, and you must have a valid election period to enroll. Either you're just turning 65, that was your initial enrollment period that we went through, or you have a special election period due to retirement, or if you've moved to a new service area, or if you've had a substantial change in your financial situation and are able to be on Medicaid as well. There are special needs plans available for you. A special needs plan would be something for like financial special needs or for a chronic care condition that has a special need, something like diabetes. There are special plans for that, and you can see if there's something, if that applies to you in your area, that would fit. Eligibility for a supplement, that's that standalone plan. You must be enrolled in Medicare Part A and B. You must reside in the state in which you are applying for coverage, your primary residence state, and you must go through underwriting if you don't have a guarantee issue or open enrollment. Open enrollment, again, is when you're new to Medicare, your first time being on it. Enrollment period for a Medicare supplement guarantee issue, again, so with your birth month, when you turn 65 and are enrolled in A and B, you have a birthday month plus 5 months afterwards to go ahead and enroll in a supplement. Again, it's that whole alphabet soup of plans. I have a slide with that. And what happens for late enrolling? You can still enroll any time for a Medicare supplement, but you may not have guarantee issue. You may need to go through underwriting to get that. And you might be charged more due to a chronic care condition if that is the case, if you go through underwriting. Again, so here's the, again, more alphabet soup. So it's so confusing for everyone. Medicare supplements are always provided by a private insurance carrier, United, Humana, Anthem, Aetna, Mutual of Omaha. You get it. Many, they provide it. The plans are regulated by federal and state laws, so they really cannot be different. The plans are alphabet soup named A, B, C, D, F, G, K, L, M, N, and then high deductible Fs and high deductible Gs also. They are not different by carrier. With a supplement, Medicare is always primary. They do all medical decision making and determination if something is covered or not. Whatever they say goes, the supplement just pays whatever Medicare tells them to pay. It's a very cut and dry contract. They do not add any additional dental, vision, and hearing with those plans. Think about it. When Medicare came out in 1965, we didn't really realize the importance of our dental, vision, and hearing to our total health. And today it's so obvious. I mean, our oral health to our heart health has been proven again and again and again. It's so important. But since it's not part of Medicare, you will not see it as part of your supplement. Okay, you can do that as another standalone plan. And then benefits, they vary state by state. Some can have a gym membership or something with it, or maybe a discount to a dentist, but it's not part of the product itself, okay? And the cost varies significantly. They are age, sex, and area rated, so the cost varies significantly across the board on the price of a supplement. And here's a general plan overview. The most popular plans in today's world, so back in the day, we had Plan F, that anyone who was on Part A as of 2020 is still eligible to enroll in a Plan F. However, those who have aged in after 2020 are not. You can be grandfathered in or grandmothered in for an F, but now I call it Plan Fantastic. Comes with fantastically high premiums, but it does pay for everything. And then now, kind of the highest level or the most popular plan is Plan G. I call it Plan Great. It's one step below Plan F. And the only thing you contribute to there is your Part B deductible, and everything's covered at 100% from there. The next one, kind of worth its salt, is Plan N, and I call Plan N plan not so bad. The premiums are lower than F and G. And all you have to do is maybe make a low copay of $20 to see a provider, $50 to go to the emergency room after you've satisfied your deductibles. So don't discount if your neighbor's on G, don't discount Plan N, because that's a real strong quality plan as well. So fantastic, great, and not so bad are the ones that are really worth their salt in today's market. Things you need to remember about Medicare supplements. If Medicare, remember I said Medicare does all medical determination and they decide if something is covered or not. The supplement is 100% secondary. So if Medicare doesn't cover it, the supplement will not. You are fully covered anywhere in the United States. Again, Medicare was developed to be a US plan. So if you do a lot of traveling abroad, make sure we chat about that and we talk about what you're at risk for and if it makes sense to go a different direction or if you just get additional travel coverage. Guaranteed renewable as long as you pay your premiums. So yeah, it's kind of like your auto insurance, you just keep paying it. And it's guaranteed renewable, okay?
Peggy, we have another question quick.
Yeah, please.
The question says, with the change to close the old donut hole, how do we ensure that our medical plans are creditable coverage? Specifically, our high deductible plans, because their deductible is over $2,000 and prescriptions fall under the deductible until it is met.
Yes, yes. They're going to be, much of it is related to the formulary. So great. That's an HR question, isn't it? Do I have someone from HR on the line? Thank you for asking.
Yes.
So, so typically you're going to find that it's still creditable and your group employer could share that with you. And it's related to the formulary. You must cover prescriptions related to every chronic care condition. So there must be, heart drugs, cholesterol drugs, like a statin. There must be, oh God, Lord, I've lost count. There's probably 50 statins on the market, but you must cover a range of statins so they handle everyone's disease burdens. You must cover a range of high blood pressure medicine so that it covers that disease burden. So it's really your formulary has to include all the prescriptions, okay? So, and work with your group plan to make sure it is still credible. But yeah, it often falls under the medical as well. So that's not different.
Thank you.
So we're going to bring this all together. Again, we have Medicare, we have our supplement and standalone prescription drug coverage. That's one direction you can go. That's the a la carte way of handling your Medicare and comes with monthly plan premiums. You pay for those a la carte and you do not get the additional benefits. In today's world, the Medicare Advantage plans are a great way of managing your funds. They're very, very, very similar to what you have now through your employer-sponsored health plan. A Medicare Advantage plan, again, I call it the cup of Medicare. If you say that to anyone else, they will not know what you're talking about. I think I need to put a little copyright symbol on that. But it holds everything in one. So you have your A, your B, most plans cover your D, your drug plan, and then they throw in extra benefits like a gym membership. You know, I think we've all heard of Silver Sneakers and Renew Active, and then dental, vision, hearing. Sometimes it will pay for your over-the-counter products that are non-prescription and things like that. So the Advantage plan, your cup of Medicare will hold everything in one place. And those are offered delegated by Medicare to handle all of that on their behalf. Okay. Again, I'm Peggy Michel. Any questions, please, 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 you'll see my email there. If I can send along those 2 forms that you need to enroll in your Part B, that's the CMS 40B and the CMS L564, I'll get you those, and then we can get those faxed right into Social Security.
That's wonderful. Thank you so much, Peggy. I love the way that you broke that down. I understand it a little bit better now.
I hope so. I hope so. Yeah, Medicare is a tricky business.
Yeah, absolutely. What questions can we answer for you guys that are still on the line? Any questions? You're welcome to jump off mute as well.
I guess a question that I have is then, so say that we turn 65 within the plan year of 2025. So then do we enroll with Selden's health plan, and then halfway through the year or whenever our birth date is, we switch over to Medicare?
You absolutely can. So this is where, so let's talk about your group plan versus Medicare. You can continue to work and be on Medicare. Turning age 65 is considered a life event going on to Medicare. So you can drop the employer-sponsored health plan through Selden and jump on to Medicare. I don't know your group plan specifically, but oftentimes I see that it's so much cheaper to go ahead and jump on Medicare than it is to remain, like if you have a high deductible or something like that, to go on to Medicare and just pay the $185 a month for your Part B if you fall into that standard income. And then you just have your benefits and switch over then. You can do it then, you can do it when you retire. You'll do it 3 months prior to your 65th birthday to answer that question, Trisha.
Okay. Or otherwise we can stay on the employer benefit plan.
Exactly.
And just when we go on to Medicare, we have to have the form that says we were on the employer plan.
Exactly.
When we switch over. Now,
exactly.
And how late can you do that switch to Medicare? Like
just whenever you lose your employer-sponsored health plan. So at any time, I mean, I guess if you.
So if you work until you're 72 or 90, you can stay on your employer health plan and then switch to Medicare.
Absolutely, absolutely. Those forms are crucial so you don't get a penalty assessed, but you can as long as you've had an employer-sponsored health plan with credible coverage.
Okay.
For that time period, and then your company will certify. That's what those forms do. They certify for you that you have had that credible coverage. But yeah, oftentimes people find it so much more cost efficient to just go ahead and pop to Medicare. So really, I guess, you know, this message is to just do your homework and see what's going to make the most sense for you.
Okay.
Peggy, I have a question follow-up to that. You mentioned that you don't have to show the credible coverage until you actually do elect Medicare, but I thought when you are going to turn 65, you have to let them know that you have credible coverage elsewhere to avoid the penalty. Am I incorrect?
They're only going to assess the penalty when you start on Medicare. So say you turn 65 and you just thought, well, I'm so healthy, I'm just not going to do it. I'm just going to go uninsured. And then when you do decide to get it, that's when the penalty will be assessed. It will not be assessed up front.
but I don't have to prove anything. If I'm going to keep my group health coverage till I'm 72,
Right.
I don't have to send them anything until I enroll for Medicare.
Exactly, exactly. A lot of times, though, your accountant may ask for it. You have that certificate of credible coverage that your HR team gives to you. So have that, keep it in your files and folders. It's happened more than once where Medicare has lost those forms or someone has lost those forms, they can no longer get it. So start a file folder and just keep that. It's good
Okay,
backup.
thank you.
Yeah, thanks for asking.
Any other questions? All right. Well, you guys have Peggy's information on the screen. I attached the presentation also to the calendar invite, so you do have this information. So feel free. Oh, do we have one more? Oh, just thank yous. So feel free to reach out directly to Peggy if you have any questions. And if you didn't get a copy of the presentation, reach out to me and I'll make sure that you get that. We'll be posting this recording out on Engage a little bit later today as well. So if someone that you know missed it, be sure to let them know or forward that link out to them. But Peggy, we appreciate you so much. Thank you for all of the great information and for joining us today.
Thanks for having me, guys. I hope you have a good day. Take care.
Absolutely.
Thank you.
Thank you.
Bye, everyone.
Bye, guys. Thanks for jumping on today.